Hello everyone, let's practice some conservative dentistry or operative dentistry MCQs. Which of the following is an example of a composite material? Of field resin, colloidal silica, gold alloy or wax? The correct answer is a field resin. Suffix is present on rubber dam retainer, denotes winged clamp, wingless clamp, deciduous teeth, partially erupting teeth. Suffix if present, it is means partially erupting teeth. If the retainer has a suffix of a after its number, it is a clamp used for partially erupting teeth. 154A and 8A ivory clamps are used for partially erupted permanent molar. In pin retained amalgam restoration, failure is more likely to occur at the pin restoration interface, pin dentin interface, both of the above, inside of the restoration. In pin retained amalgam restoration, the failure generally takes place in the pin dentin interface. Then at the pin restoration interface, for explanation refer point number 36 under pin retained restoration in synopsis. That's not a good explanation. Microabrasion is used for enamel stain, incipient caries, arrested caries or hidden caries. Microabrasion, it is used for enamel stain. It involves the use of acids to remove the superficial enamel stains. Earlier 18% hydrochloric acid was used. Crowell reduced the concentration to 11% and increased the abrasiveness of the paste by adding silicon carbide particles. This is called Prima compound. For cast restorations, the cavity wall should have a taper of, for cast restorations, it should be 2 to 5 only taper should be there. Stress in cold working can be relieved by is hardening, annealing hydrochloric acid and beating. It can be reduced by annealing. Smooth surface caries refers to facial and lingual surfaces, occlusal pits and groups, mesial and distal surfaces. Both A and C are smooth surface caries. One of the following is the best of prevent pulp damage during cavity preparation. It means to say best way to prevent pulp damage. Retain smear layer, use sharp burs with brush stroke, use surface anesthesia, use adequate water coolant. Water coolant is a must. Which of the following is true about direct filling gold? Properly condensed matte gold has no voids. Whatever may be the type, voids are inherent. Voids can be avoided with manual condensation. Whatever may be the type, voids are inherent. That's the correct answer. Proximal walls in a class 1 tooth preparation for amalgam should converge occlusally, diverge occlusally, remain straight or rounded. It is proximal walls. Proximal walls in a class 1 tooth preparation. So they should diverge occlusally, okay? Only the labial and lingual, facial and lingual walls converge. The most recent direct filling gold, which produces the hardest surface on condensation, it is matte gold alloyed with calcium and wrapped in gold foil. That is the patient complains that a tooth with a recently placed large mesio-occlusal distal restoration is tender to mastication and exhibits occasional thermal sensitivity. Which of the following is the most likely cause? Micro leakage, recurrent caries, gingival recession, premature occlusion. That may be due to premature occlusion. Okay, some high points may be there because it is a recently placed large restoration. The X-ray of choice to detect the proximal caries of the anterior teeth is, in case of anterior, it is bite wing. Greatest potential hazard of mercury toxicity occurs due to skin contact with mercury, inhalation of mercury vapors during amalgam restoration, ingestion of amalgam scrap during removal. Inhalation of mercury vapors is the correct answer. Root caries is attributed to action of Streptococcus mutans, Lactobacillus, Actinomyces viscosus, or Actinomyces nicelundi. The correct answer is, it is both 1 and 3, no, because Streptococcus mutans is a pioneer and Lactobacillus is found in dentinal caries and Actinomyces in the root caries. That's it for today's MCQ series. We'll see you again in the next video. Thanks for watching.